Carolyn, what final advice do you have for these women who may possibly have a transvaginal mesh?
Well, the symptoms that they should be looking for are whether they're having pelvic pain, vaginal pain, if there's erosion into the tissues, if they're having that feeling like the Brillo pad that's been described by so many spouses and loved ones, if they've got any kind of urinary incontinence that is continuing, if they have a recurrence of the pelvic prolapse, if they have urinary tract infections. These are all some of the many explanations that have been attributed to the transvaginal mesh.
Carolyn, what advice do you have for the women that are experiencing the symptoms that you just described, but their doctor has not identified those symptoms as arising out of the transvaginal mesh?
Well, many of the women have gone to an OB-GYN. They're OB-GYN for their annual PAP, and they are experiencing all these symptoms that are related to the transvaginal mesh. But the OB-GYN is not trained to know that that's part of the urogynecologist problem, and the urogynecologist will make that diagnosis. So the women need to either go get a second opinion from the urogynecologist who actually did the surgery, or another one who is proficient in that area, rather than relying on their OB-GYN.
Well, there's the additional problem, Carolyn, that a number of our clients who turned out to have transvaginal mesh implanted and the problems arose out of transvaginal mesh were not told that by their doctors. Because a lot of doctors do not want to tell a patient all these problems that you're having and the failure to correct your incontinence or the prolapse problem are from the mesh that I implanted in you last year. So what else can they do besides go to the doctor?
We're not suing the doctors. They're not part of this litigation. We're only going after the manufacturers. The doctors would have never implanted this mesh in their clients had they had any idea that it was a dangerous and defective product.
So, Carolyn, I have a transvaginal mesh implant and I'm going in for surgery. Is there any advice that you can give to the women out there?
Oh, yes. Definitely contact us. We need to preserve that evidence. We need that mesh preserved. Tell everyone that you can related to this hospitalization that you're undergoing. The person in the holding area, the anesthesiologist, the nurse, make sure they put a big note on the chart that they retain the evidence for us. So contact us immediately. We'll send a notice to the hospital to preserve that mesh, but you also need to tell them to make sure that that's not tossed off the surgical field and into the garbage.
The other problem that we're having in obtaining the mesh is most people don't realize it when you're a patient in the hospital and you have a medical device. But there's a representative from the manufacturing company in the surgical suite at the time of your surgery. So the mesh that is being explanted may be picked up and destroyed by the manufacturer's rep in the surgical suite unless you've taken exactly the right steps to prevent that from happening. So if you contact us before you go into surgery, we will put the hospital on notice and the doctor and the anesthesiologist, and we will send them an explantation kit. So with full instructions as to exactly what is to be done with the mesh so that it's properly maintained, it's properly preserved, and it's sent directly to our expert witnesses where it'll be kept as part of the chain of custody, and we can avoid evidence problems with it in the future.